Okay, good afternoon, everybody. It's my pleasure to be here to share our research on the teaching health economics in China. Instead of details what's the activities in our classroom or the course design, I'll just give a general descriptions what's the current situation of teaching health economics in China. It should be the same, but actually it's very different, because the Chinese healthcare system and how the government's role in both the healthcare system and the education system. So here is our team members for this project. It has Professor Tang and Professor He. We all teach in School of Public Administrations, and also some PhD candidates in health economics and master candidates in health administration. We initiated this project because we set up the health administration program a couple of years ago, and we're facing a lot of frustrations from both instructors and students. For the instructors, we all get trainings from Western countries, and the health economics we learn is very market-oriented. But in China, the situation is very different, how to make it very relevant to the Chinese current system. And for the students, most of the students, they came to School of Finance and Economics, and they want to be working in the bank, because they make them a lot of money. But why they choose this program? Because in China, it's very hard to get involved into universities and the graduate school. So if their score is not high enough to be in the finance major or whatever, they were assigned to this program. So how to make them to be interested in health economics? And they don't. We have a lot of challenges, as we talked in the previous sessions, because some students doesn't have any background in healthcare, or they don't know anything about economics. And for this, they don't even interested in this stuff. So people always ask how that could help me, And eventually, although for us it makes sense, it's very important, but for them, if they go to bank, how they can help them. So we just thought it will make you healthy and wealthy after you got this. But actually it's not a joke. We hope our students, they know what really health is and how the economics really works. Not only help them to choose health insurance, or how to even be a good person in their daily life. It doesn't matter what their career will be. Okay, before I give details about some course study, health economics teaching, I'll give you some background about the current situation, why health economics teaching is very important. Because as all the other countries, there's the health expenditure is growing up very fast, and there are a lot of overuse or underuse of these medical services. So there's a lot of increasing awareness to make the healthcare system efficient from both policymakers and the researchers. However, there's a challenge to teach and design this health economics course, because there's various understanding and trainings in health economics. And also, as I mentioned earlier, the healthcare system and the education system is very different. As you might know, before 1978, before the economic reform, Chinese is more like socialism, it's more government central planning. And even right now, even the public, so most of the hospitals are owned by the government, like before 1978. Right now, although there's the public-owned hospital is only represent less than 50%, but this is the number of hospitals. But most of the government-owned hospitals, they're really large size, and about 80% of the clinic outpatient visits and hospitalizations are still in the public-owned hospitals. And also, the government to control the human resources was even the president of the hospital, and how they will control or make planning about those human resources, the health professionals in these hospitals. So this makes us very hard to teach the health economics. What's the government's role? What's the market role in all this? And also the education system, how do we design the program? We have most of the courses are taught in medical schools instead of in economics department or in the other universities. And also when we designed it, we have disciplines, we have different level of economics and management disciplines. And most of the health economic courses are taught in social medicine and health administration. So it's under both the economics and the management discipline. So that also and also for us, the health administration is different than when we talk about health administration here, because we talk about the hospital or the private sectors. But this one, since we are in School of Public Administration, so when we design the course, we're focused more from the social perspective or what's the government's role in it. Okay. So when we try to start this study, we want to see what's going on in China with the health economics teaching. So we use the evaluation report of Chinese universities and the specialties in year 2017. Because there are about over 2,500 universities in China, so we only focus on the top 20 in it. And we also focus on this program since most of the health economic courses are taught in the social medicine and the health administration program. And we focus on the postgraduate level, most of the master degree level. And we choose the top 20 medical schools and the top 20 universities with the social medicine and health administration specialties. So, because on both lists there are some repeated schools, so finally we have this 36 universities and schools. And here is a map that's about the universities we're looking for. As you can see, most of them are from the East Coast, because here are where the more developed states, and there are a lot of good universities. So most of the top universities are among these areas. And most of the schools in the universities with health administration, most of them in the School of Public Administration, Public Health, as in those universities, although they also have economics and business administration. As you can see, the total number is 20 universities, but the total schools are 22. This is because in some universities, they may have a public administration and economics and the business administration, and both schools provide these health economic courses. And for those medical, I listed here as medical universities because in China, the medical school there are some very large medical schools, and they don't just have like medical clinical related schools. They even have arts and science in these medical schools, and they have a public administration and public health and management programs. So in different schools, the course design are very different. And for example, based on the categories, we have those core courses for the health administration program, and some are major required, they have different majors, and some are electives. So based on the different requirement, the course of hours ranging from 16 to 72. For some elective course, they're very short time for this. And the level, there's some introduction level, media level, and advanced. So although some course, I just called the health economics, but they also course specifically designed as the health economics evaluation, pharmacoeconomics, or health finance, as what we're using. Sorry about this. And in terms of the textbooks that we searched, like currently, we feel when we design the courses with most of the students in China, they have textbooks. But like when we get training in the US, it seems we use a lot of papers, the current readings, but they just, because in their high school or even in their in the college undergraduate level, they're so familiar with textbooks. So we just want to choose what's more relevant, what's helpful for them. So we check what's the most available or popular textbooks. We find the total there are about 23 different type of textbooks, and there are 5 English version and translated that has been used, and also there are some very authorized textbooks, like from the administration. They're required or published from the Ministry of Education, and there are some special textbooks for the case studies. So here is some, like as you can see, the most popular textbook we used are from Professor Folland, and it's the Economics of Health and the Healthcare, and the different editions has been translated. And also we have the methods for the economic evaluation of healthcare programs. But when we teach the cost benefit analysis or cost effective analysis, most of the instructions don't use these textbooks. They all use most of the Chinese version ones. For example, we have some health economics textbooks, and they include the cost effectiveness analysis. So here is just a part of the textbooks we listed. And as for the content, we said that there are some Chinese editions and there are some English editions. Most of the English editions are taught in the universities with specialties in health administrations. But most of the Chinese editions, they're taught in the medical schools. Originally, these health economic courses are taught in the medical school. It's different than here. I think in the US and some other Western countries where they're economic focused. But for this one, they're more like administration oriented or focused. So they're in the hospital, they're in the medical schools. So the content is pretty similar, health services, demand and supply and the market, or health financing, but the details are very different because, for example, the demand and supply, we may talk more about what's the design and what's the human resources allocation by the government. And instead of just market efficiency, we talk more about the equity, how to make it available in the rural place. So although the topics are similar, but the detailed content are some very different. And also most of the English books, there's a lot of econometrics analysis tools, or a lot of use the economic theory to analyze the current situation. But when we talk about most of the Chinese books, they don't use too much those econometrics tools. It's more descriptive instead of a lot of analyticals. They just give introductions or focus more about what's the government's role. So as for the instructors, we're very different too, because we have some domestic professors with domestic trainings. Although most of them have PhD degrees, some of them have master degrees, especially those that are in the older generations, because that is in the medical school, maybe they have background in administration instead of they have much economic backgrounds. And for most like myself and my colleagues, we all get overseas training, and almost all of us have PhD degrees in economics. So it's a lot of times it took us a long time to know more about the management situation with the current healthcare system in China too. So, and most of us, like in general universities, either in the econ department or public administrations, or in the management school of management. And compared to those taught in medical school, these professors are relatively young because they are training from Western countries. So it depends on the instructors, the content we taught, the textbook we choose are very different too. So in summary, we said currently the health economics is very popular and taught in almost all the top universities and some medical schools. As in the 20 medical schools we evaluated, there are a couple that doesn't teach health economics, but all the universities we do. And also the content are very different based on the specialties. Some in the medical school and some in the econ or school of management. And there's a lack of theoretical and analytical tools based on the microeconomics or econometrics. So they give them, when they evaluate the student's course, it's more memorized or descriptive situations instead of give them critical thinkings. And again, the field, they're related to the public health economics. As we mentioned, is from the government perspective. However, because the health, what's the public health economics, even in the English textbooks, we're lack of that, because it's more like private or market oriented. But right now, even in China, we focus more about preventive care. But how that's related to the health economics, in addition to tobacco control or some vaccine, but there's still a lot of things we need to do because currently, because the aging problem and because the chronic conditions, we need a lot of involvement from the community health providers and even the social workers. So how to make them both from the government perspective and market perspective. Okay, so from our experience and this project, we find first we need to clarify what's health economics for the students. Instead, in addition to the demand and supply of the market and what's the moral hazard or what's the supplier-induced demand, what's the really health is and what's the healthcare or the medical delivery system really is. So that's more relevant to the current situation, not only in both China, but also all the other countries all over the world. And again, as I mentioned earlier, we need to help them to develop analytical and critical thinking skills or analysis skills. And also, for us, we feel that it's very important to have those knowledge, have multiple discipline knowledge that can integrate both the government and market theories that can fit the current economic and society development all over the world, including China. Okay, thank you. Any questions?
Questions? I teach health economics in Australia, in Sydney in particular, and we have a decent number of Chinese students actually. And I was wondering whether or not you had some tips about how to teach health economics to international Chinese students, what kind of, because we do a lot of interactive kind of exercises and online content, what things to avoid and what things they might prefer?
First, sometimes we use those English textbooks, and most of the focus on the American situations with Medicare, Medicaid, and also was the physicians, their situation, how do they choose the careers, and how they maximize what either their utility and everything. But in China, maybe the situation is very different. So those students may be interested how that related to them. For example, the physicians, they're not self-employed employees. They're employed by the hospital. So this one makes it very different how they make decisions, and because the government involved. So maybe that can relate. Maybe it's let them to introduce the situation and how that's related to the course that we're teaching. That should be very interesting. Because we use a lot of case analysis. Although the theory should be the same, but when we apply how the pharmaceutical pricing, for example, in China is very complicated, and why it's much more important than even the clinical or hospitalizations, because there are a lot of during the pharmaceutical producing or the competition, because there are 5,000 pharmaceutical companies in China, and it's very different. And so here we talk about, the more competition is good, the better, right? But actually it's different. It's not, because they're not good competition, because nowadays they try to use some more flawed, a lot of stuff like that. So so there are a lot of things that you can discuss about those situations. All right.
I think, I'm not sure, probably you mentioned on this. So how many of those schools actually teaching the health economics in English? Is there actually most of them actually teaching?
Well, actually, some when I first went back to China, 5 years ago, I taught in English. But eventually now I teach in Chinese because it's not, because we cannot tell it in English, but it's hard for them to grasp the ideas. So sometimes we use English textbooks and we give like the slides, in English slides, but we talk in Chinese to help them to better understand.
So follow up with that question. So have you realized, I realize that sometimes the Chinese translation of certain terms maybe are different.
Right.
Have you find out among those textbooks whether they have similar translation, whether there's a consistent term?
Not really. So it's frustration. So we don't really like to use those translated textbook either. All right.
Any more questions? Thank you very much.